We described the pharmacokinetic and pharmacodynamic properties of antibiotics used for UTIs. Now let's identify signs and symptoms of cystitis and pyelonephritis. Let's take a look at some key definitions. When you get a urine sample from a patient, for most individuals there will be no bacteria in the urine. The urine is supposed to be sterile, especially in men, and we call this sterile urine. Now, if you find bacteria in the urine sample, this could be due to contamination of the sample. This could be from the skin of the patient or from the environment. Once you rule out contamination, if there are bacteria in the urine, we call this bacteriuria. This means the presence of bacteria in the urine. If a patient with bacteriuria has no symptoms, we call this asymptomatic bacteriuria. This is not a urinary infection and does not need to be treated in most patients. If the patient does have symptoms, however, we call this symptomatic bacteriuria, or more commonly known as urinary tract infections. What exactly are these symptoms? The four most common symptoms are frequency, so the patient has to urinate small amounts frequently, and it will be painful, which we call dysuria. There will also be urgency, or the urge to void immediately, and there can also be hematuria, or the presence of blood in the urine. As I mentioned earlier, there are different types of UTIs. The most common one is cystitis, or the infection of the bladder. There is also pyelonephritis, which is not as common but is very important. Symptoms that are more specific to pyelonephritis include fever, which is not always present, but if it is suggestive of pyelonephritis. There will also be CVA tenderness or flank pain. CVA tenderness is detected during physical exam, typically by a physician as they tap on the back of the kidneys with their fingers. UTIs can also be considered uncomplicated or complicated. For example, there's uncomplicated cystitis or there is complicated cystitis. Let's take a closer look. Now let's distinguish between uncomplicated and complicated UTIs. Uncomplicated urinary tract infection refers to infection in a structurally and neurologically normal urinary tract. And the reason this is important because when there is normal anatomy and physiology, the urinary tract gets cleared much easier than when there is anatomic abnormalities. The generally accepted definition of complicated UTI includes infections in the presence of factors that predispose to persistent or relapsing infections, and those include the presence of foreign bodies such as calculi or indwelling catheter, obstruction in the urinary tract, the presence of immunosuppression, renal failure, renal transplantation, or urinary retention from neurologic disease. These factors are important because not only do they make the clearance of bacteria from the urinary tract more difficult, but they also increase the likelihood of relapse. In addition, infection in men, pregnant women, and children, and also patients who are hospitalized or reside in the healthcare, they may be considered complicated. And more importantly, in patients with complicated UTIs, infecting microorganisms are more likely to be resistant to antimicrobial agents. And that's primarily because of these risk factors. The patients are more likely to have been exposed to antibiotics for other reasons, for other complications that they may have had. So these bacteria are more likely to have had a chance to develop resistance.